with remarks from Governor Tony Evers.
Thank you, and good afternoon, everybody, and thanks for joining us today. I'd like to start by saying that I hope everyone who celebrates had a meaningful Easter and Passover. I'm certain that these holidays felt much different than years past. Instead of a house full of family and friends over the holiday weekend, Wisconsinites were sharing meals and making memories online and over the phone. It's another reminder that this virus has impacted our lives in so many ways, but also a testament to our resolve and resilience as Wisconsinites. The last few weeks have been a difficult time for our state. I share with you the sorrow we all feel at the illness and loss of so many of our family members, friends, and neighbors. But I also share with you a sense of optimism that we will get through this together. I remain humbled by the bravery and dedication of our critical workforce, including our healthcare workers, first responders, child care providers, public employees, and grocery store workers. I am inspired by the kids and educators of our state who are adjusting to ever-changing new normals and trying to make the best of a bad situation. Parents, grandparents, and caretakers, I know this is tough on you as well. Our educators are doing a great job, but I know that our kids often need help at home, which can be challenging for those of us working from home. I'm also encouraged by the innovation and kindness of the makers, doers, and givers of our state. We continue to hear about folks stepping up to donate blood, sew masks, and make face shields, and about communities banding together to help one another. Because that's how we will get through this, folks. Together. Everyone has to do their part. We're now well into the 4th week of our Safer at Home order. The science tells us that right now the most effective way we can keep COVID-19 from overwhelming our healthcare system is to continue to practice social distancing so that we can slow the rate of infection. So not only is this the right thing to do from a health and safety standpoint, but it's the only way we will all be able to get back to life as we have known it, as our businesses, our schools, our places of worship, and even with our family and friends. We are starting to see Wisconsin flattening the curve, which means that Safer at Home is working. We talk a lot about flattening the curve. It's a phrase most of us have never heard of up until a few weeks ago. Folks, it's actually pretty simple, and here's what you need to know. When we talk about flattening the curve, we're talking about fewer people getting sick. We're talking about less of an impact on our healthcare systems. We're talking about saving lives. We're talking about your neighbors and coworkers and friends and family. We might even be talking about you. These are the lives we will save if we continue to flatten the curve. This is about more than the number of positive test kits our labs process. We're talking about people. Folks who want to attend their kids' graduations or see their grandparents blow out birthday candles or just play a game of euchre with their neighbors tonight. And yes, for now, some of those events may have to happen virtually because we're staying at home and practicing physical distancing. But with Safer at Home, we have fewer infections, fewer confirmed cases, less strain on our hospital system, and more happy events to celebrate. Because Safer at Home is saving lives and keeping Wisconsin healthier than we would have without it. I'm so thankful for you, Wisconsin, for taking Safer at Home seriously and continuing to protect your friends and family and yourself by following it. I know this goes against the grain for most of us here in Wisconsin, when there's a flood or a fire or a tornado, our natural instinct is to stand side by side and help each other, whether it's filling sandbags or distributing food or clearing debris from the road. This time is different, except for the folks on the front lines. The most help we can give each other is to keep our distance for now. Once the danger of COVID-19 is past, that will change, and we can be with each other safely again. And now I'll turn it over to Secretary-Designee Andrea Palm, who will give an update on the important work we're doing to continue rising to the challenges posed by COVID-19.
Thank you, Governor. Good afternoon, everyone, and thanks for joining us again today. In this crisis, we must work together, and just like all of you are working together to stay safer at home, DHS has been working through our State Emergency Operations Center strike teams to respond to our immediate needs and begin to prepare us for the next phase of this response. A lot of very smart people have been putting their heads together to provide us with the data we've needed to make policy decisions. Like the governor said, our data and our models tell us that the policies are working to flatten the curve. When we hear flatten the curve, we think graphs and lines and color coding and numbers, but we need to remember that the curves on those graphs represent people, and the flat line indicates our hospital capacity. If the people curve isn't below the hospital line, those who need hospital care won't get it. Flattening the curve means we can treat all those who need hospitalization, and it means saving lives. As part of this effort, we've increased the contact tracing capacity of local health departments to follow up with people who have tested positive for COVID-19, making it possible to better track the virus and check in with others who have been potentially exposed. Policies like physical distancing and safer at home have made it possible for our local health departments to increase the percentage of cases they reach with contact tracing and decrease community spread. And we will need to continue to significantly expand our contact tracing capacity to effectively manage this outbreak moving forward. This is another reason that building our lab capacity is so key during this crisis, and we will continue to focus on increasing testing moving forward. In fact, we have 23 active labs running COVID-19 tests in Wisconsin today with a daily lab capacity of 3,886 tests. The more effective our safer at home and physical distancing policies are, the more effective our testing is at reaching people who need it most. And moving forward, our expanding capacity will work hand in hand with our contact tracing efforts to facilitate our ability to actively and aggressively manage this pandemic. And for those with symptoms or who have tested positive, we've opened 2 self-isolation sites and provided guidance and blueprints for local communities to do the same. These facilities will continue to be a critical asset as we further ramp up testing and contact tracing by providing places for safe isolation and quarantine to reduce community spread. While it's not enough, personal protective equipment continues to come in through the PPE donation and buyback program, and that PPE continues to be distributed to first responders. Working with the Army Corps of Engineers and local leaders, we have scouted sites to build out Wisconsin's healthcare system capacity. This will include alternative care facilities on the grounds of the Wisconsin State Fair and at the Alliant Energy Center in Madison. An alternative care site needs staff to run it, and hospitals and clinics across the state will also need more staff during a potential surge in cases. This is why we've launched the Wisconsin Emergency Assistance Volunteer Registry, as Governor Evers announced last week. If you're interested in volunteering, please visit the website weavrwi.org to learn more and to sign up. Wisconsin needs you, and we are so grateful that you will be volunteering. So let's get to our daily numbers update. As of today, we have 36,769 negative tests, which is an increase of 853 over yesterday. We've one county reporting cases for the first time, that's Green Lake County. There are now 3,428 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 87 cases over yesterday. I know it can sound discouraging to hear an increase in these numbers, but it is important to know that we have actually seen a decrease in the exponential growth as a result of safer at home. We are flattening the curve. Our number of COVID-19 hospitalizations is 993, which is an increase of 19, and this means that 29% of people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total death has now reached 154. We know this is a difficult time for everyone in Wisconsin. It is true that you are safer at home, and it is true that safer at home is saving lives, but that doesn't make it easy. That is why we also have teams working on community resilience, working to provide you with the tools to deal with stress and adversity and to bounce back from these challenges. If you are looking for tools and resources about dealing with stress, I encourage you to visit resilient.wisconsin.gov to learn more about our Resilient Wisconsin initiative. This is a stressful time, and we need to remember that one way to reduce stress is to reduce our risk of infection. Each of us can do our part to keep ourselves and others healthy and safe by staying safer at home, practicing good health hygiene practices, and following physical distancing guidelines. Thank you for all your hard work, Wisconsin. We are making progress, and working together, we will get through this.
We will now open it up to questions. A reminder to maintain audio quality. Keep phones on mute until it is time to ask your question. In the interest of time, also, please one question per reporter. And we'll begin today with Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I know this just came out earlier today, but we got to see a draft of the bill that Republicans plan to bring up in the Senate tomorrow, and it sounds like the Assembly draft will be very comparable. I was just curious if the governor's had any time to take a look at that, and if he has any immediate takeaways or thoughts on kind of what's being proposed.
Sorry, I was busy this morning talking to agricultural groups across the state, as well as business officials in the Milwaukee area and other things. So I have not seen it. I saw some preliminary drafts, and so what I'm hopeful for is that we can agree around this package. It's clearly, I mean, if it looks anything like the draft, which I don't know for a fact, but looking at and responding to the draft, there are things we can agree with, and most importantly, having to do with the 1 week, waiving the 1 week, and also the FMAT to make sure that we get the resources we need in the state of Wisconsin. Other than that, I can just tell you, and I guess I would also like to timely answer into the people I was meeting with this morning virtually. There's an expectation on the part of small business owners and workers in the state, as well as our agricultural community, especially them, that the state of Wisconsin can step up and help them out financially. And so hopefully this will not be a one-shot answer to the crisis here in Wisconsin, but an opportunity to establish a dialogue so that we can talk about the farmers of the state, talk about the importance of small business owners to our state with the hundreds of thousands of people that employ them. But we'll take this, again, I didn't see it. I'm looking forward to seeing it and hopefully coming to some conclusion on these items.
Thank you, Mitchell. Now to Dylan Brogan from Isthmus. Dylan?
Thank you, Governor. Do you believe that voters were disenfranchised in the election last week? And knowing what you know now, would you do anything differently?
I'll answer the last question first, because I'm asked that a lot. I don't know what I could have done differently. The Supreme Court has decided that it was unconstitutional for me unilaterally to do that. I didn't think that was the right decision, but the fact of the matter is that it was made that way. Second of all, if I had done that earlier, the result would have been the same. They would have turned it down 5 weeks before that. So do I think that I succeeded in that effort to delay the election? No, obviously not. Do I think that voters may have been disenfranchised? I don't know that for a fact, but the facts are that I'm sure many people weighed the difference between being unsafe and exposing themselves to an unhealthy environment or voting. Some of them, I'm guessing, did decide not to vote. And if that's a different definition of disenfranchisement, then I guess it is. But as you know, the courts will rule on this in the end analysis.
Thank you, Dylan. Now to Danny Maxwell from WKOW-TV in Madison. Danny? WKOW in Madison.
Yes, this is Emily calling in replacement for Danny for WKOW. Governor, how do you see the state's reputation being impacted now that we are just hours away from the election results coming out?
As it turned out, it was a mess that could have been avoided if the Republican legislature would have joined me in moving that date, but that didn't happen. At the end of the day, this will be resolved in court, and then we can move on. What we need to learn by this, and reputation, I dispute that it's going to wreck our reputation. Frankly, I don't know exactly what that would mean. But what we do need to know going forward is, with the benefit of more time, that we can continue to encourage people to vote by mail and make sure that we are able to get ballots out to people in time so that they can return them in time. I think it's pretty simple, and it's clear from at least the evidence that I've seen thus far is that Republicans and Democrats, probably in pretty equal numbers, decided to vote by mail. So I don't think there's any, shouldn't be much discussion about whether this advantages one party or the other. So we need to learn by the experiences we have, but as far as people not wanting to move to Wisconsin because of this election, I don't think that's a fair assessment.
Thank you, Emily. Now to WISC TV in Madison. WISC? Stephanie Fryer, WISC. And a reminder, *6 to unmute your phone. Okay, we'll move on then to Taj Mahal from NBC 15 in Madison. Tajma?
Hello, thanks for taking my question. This question is for the governor. President Trump tweeted today basically saying that he plans to decide when guidelines for stay-at-home orders will be eased, not individual governors. What's your reaction and take on that?
I don't believe that's an accurate statement.
Is there any
One question, Tajma, I'm sorry. We'll move on then to Shali Pittman from WORT Radio. Shali? WORT Radio.
Hi, this is Jonah Chester, filling in for Shali Pittman. Thank you for taking my question. An early draft memo of the proposed GOP COVID-19 response legislation removed civil suits against medical equipment manufacturers that are donating to medical providers. In light of that, what is your administration and DHS doing to ensure proper quality and manufacturing of those PPE and medical assistance equipment?
Well, I'm not sure that's what's in the final draft, so it's hard for me. It seems like a reasonable thing to do to have those benchmarks in place, but not having seen the final bill, I can't respond to that question.
I think I can add a little bit to that too. So in some of the preliminary versions of the draft, the governor's office provided some feedback in order to improve those provisions. In terms of what the state is doing with the equipment and stuff that we're purchasing, it's something that we keep a fairly close eye on. One of the challenges that Wisconsin's facing and states around the country are facing in this scramble to get PPE is that there are, people who are selling fraudulent face masks. We're seeing examples of those where they simply stamp N95 on them and they're clearly not N95. And so that is something that we're being very careful about when we're making these purchases. We're making sure that we're protecting Wisconsin taxpayers, and more important, and just as importantly, before we distribute any of that, we're making sure that the equipment is what it says. But, that is one of the reasons why we hope that in this final version of the package that it doesn't protect people who are selling fraudulent products that could harm the public.
Thank you. Now to Robert Chappelle from Madison 365. Robert?
Hi, good afternoon. I want to follow up on on testing and whether or not the guidelines that have been, last week you talked about sort of broadening the guidelines for who gets tested, and whether or not that's had any impact yet in the number of people being tested, and then also is there any plan to start to be even more further broaden the testing just to get ahead of people who maybe aren't either are asymptomatic or just trying to get a broader sense of the population health using some of those testing protocols.
So I'll let Dr. Westergaard chime in here as well. I think what we're likely to see coming out of the holiday weekend is probably not as many tests as we have seen previously, and I think some of that is probably reflective of the fact that people were celebrating the holidays in this new normal and did not seek out testing. But I think we continue more broadly, irregardless of the numbers over the weekend, we continue more broadly to want to ramp up our capacity as well as make sure that we are communicating well with providers about their discretion to order tests when they think that is warranted for a patient that they are that they think needs to be tested. I think we also are very interested in using some targeted capacity to make sure we are wrapping around outbreaks in places like long-term care facilities, assisted living facilities, jails and prisons, and other congregate settings where our ability, again, to sort of wrap around that situation with testing and contact tracing will help us mitigate further spread. And so we're going to press on a number of different channels to build the number of tests more in line with the capacity we have as we continue to ramp capacity here in the state of Wisconsin. I don't know, do you want to add anything to that?
No, I think this assumption that testing might have been lower over the weekend in general is pretty accurate. We've been communicating with healthcare providers and systems that the overall capacity in the state is much higher than it was. I think there still may be regional variability in that, particularly in the non-hospital setting. I think there are some areas where local resources with specimen collection and transport might be a bit of a bottleneck. But I agree with overall your assessment of the strategy that in the healthcare system where we have the resources that we need, and we want to strategically increase how we test in some of these other high priority contexts.
Thank you, Robert. Now to Fox 11 in Green Bay. Fox 11.
Hi, thank you. It's Mark Leland from Fox 11. I was wondering about the numbers. Based on the statistics on your website, it says about 16% of those who have tested positive have been healthcare workers. I think it mentioned 553 cases. With that in mind, what concerns do you have for Wisconsin being able to respond and handle to a surge in cases if and when that happens? And are all the necessary steps being taken to prevent and protect our healthcare workers?
Thank you, Mark. It's a good question, and it actually also highlights the fact that this is a new visualization, a new graphic that we started providing today based on interest and really sort of getting to your point, Mark, about the impact on the healthcare workforce and what that means for what we need to do to make sure we have enough healthcare workers in anticipation of potential surge and to continue to treat the folks who need to be treated. I think there are a couple of things that have been going on here in this state that will help us manage this. One is what the governor announced last week, which is this volunteer registry where folks who want to be available in situations where you might have some healthcare workers all from the same location who are sick and you need to replace them with assets from outside that system. This registry can help us pair and match people who are qualified to those kinds of needs. But then also we have done a number of things in the last couple of weeks around licensure and relaxing administrative rules to allow folks, who have retired to come back to pick their license back up. Some interstate reciprocity admin rule flexibilities, and some other things that are really designed to expand the pool of folks who can pitch in and help should a healthcare facility get into a situation where they've got a number of healthcare workers out sick and need us to surge some assets for them.
Thank you, Mark. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, this is Casey Nelson filling in for Rob. Our question is, with just about 100 people being the increase in cases here and there, people are on both ends of the spectrum saying that's a lot, or maybe that's not a whole lot. What is really the reality of seeing only about 100 or so confirmed cases every update here?
Yeah, I think it's a great question, and it's an important observation. So the answer is that 100 cases is much better than 1,000 cases that are being seen in other states, but it's probably not low enough for us to feel confident that there's not a fair amount of community spread in multiple areas of the state. So what we've learned from other epidemics in other countries is that when we have a similar testing infrastructure like we do, we probably detect some low percentage, between 10 and 20% of the true cases. So we don't have enough data yet. We will someday when we can scale up some of our other surveillance tools, but we don't know what that proportion is. How big of a tip of the iceberg is it? So what it tells us is that we are have a number of acutely ill patients that have COVID-19 that at this moment is not straining our hospital capacity, but it also unfortunately tells us that there's a sustained transmission in the community. That means that there's a large number of people potentially who are infectious, and that if we relax safer at home, or when we relax safer at home, we're really going to need to be able to zero in and contain those individuals. So it's good news and bad news. Clearly, we're not at the surge that's straining our healthcare system capacity, but we're also not at such a small level that we're safe from having an expanded epidemic like seen in many countries. So we're watching it very closely, and we're one thing that we're certain about is that the level we're at is much, much better than would have been projected at the beginning when we had that exponential growth that was seen in other curves. So in other countries. So we've clearly flattened the curve, and the number of between 100 and 200 cases a year is evidence of that, but it does mean that there's still transmission in the community right at this moment.
Thank you, Steve. Now to Addie Bink from WFRV TV in Green Bay. Addie?
Yeah, hi there. So we've seen some forecasting that says that Wisconsin peak for the pandemic was actually yesterday. I was just wondering, maybe this for Westergaard or Secretary Palm, but if you believe that this is true, or if you think that we have yet to see a peak of the virus in the state.
Yeah. I'll happy to take that. I mean, it would be wonderful if that was true. We very much hope that it was, but the truth is we don't know. You don't know what the peak of the curve is until you're on the other side of it, and you've seen the sort of the first wave of the epidemic come and go. So the message that we'd like to give is that it's really where we go from here really depends a lot about how we approach the coming weeks. The cases that we're seeing right now really reflect people who were infected a week or two ago. So the trend that we see now is going to depend on how we maintain our physical distancing and our infection control practices in our healthcare system. And we're, if this is the peak, if the peak was yesterday, that will be evidence that we've done a really good job. But the other point that we want to make is that, it doesn't mean that we've eradicated or eliminated. We flattened the curve, but we haven't smashed the curve down to nothing. So there's still people with the infection in the community that we don't know about. So we need to be very careful, make sure we have all the resources in place. As time goes on, we can keep the curve low, because we're not out of the woods in terms of having another surge when things change in terms of our physical distancing.
Thank you, Addie. Now to Cammie Rapson from WBAY. Cammie?
Hi there. I wanted to follow up on the comments from President Trump over the weekend. He specifically said that the decision to relax social distancing guidelines would be up to him and the federal government rather than the states. I want to know, again, how the governor feels about that and whether he's given any input to the White House as the president suggested he was meeting with governors to discuss this.
Well, as I said before, I don't agree with his assessment. Clearly, all along, the governors have taken a lead on this all across the country, and I anticipate that's going to continue going forward. And have I personally talked to the governor or the president about this? No, I haven't, but I know the governors that I interact with have reached the same conclusion. they're the ones that are ultimately responsible for what happens in their state. And so we're hopeful that the president will be on board with the good work that's being done in the states.
Thank you, Cammie. Now to John Neiser from NBC 26 in Green Bay. John?
Abigail for John. Now, I know we kind of mentioned the possible connections with the in-person election, but we've seen a huge spike in Brown County, it just seems, in the last 5 days after the in-person election. So I'm just curious again, are you guys worried about that concern and when we would start to actually see or know how many people are affected because of that?
Do you know anything about Brown County specifically?
No, we're seeing a steady increase or low-level increase case in a number of counties, but not aware of a specific outbreak in Brown County. But we haven't heard.
So I think more broadly, Abigail. Obviously, we continued with our expanded contact tracing efforts to interview every positive case, to track the people they have been in contact with, to notify them, to help folks get into isolation who need to do that, to help prevent the spread. And we will continue to do that, whether it's around in-person elections or other places where spread is happening. And we just will continue to watch our data and bulk up our assets so that we're able to do this in the most effective way possible.
Thank you, Abigail. Now to Lauren Cox from WCLO Radio in Janesville. Lauren? And a reminder, *6 to unmute your phones. Lauren Cox from WCLO Radio.
Hi, yes. My question is for the Secretary Palm. We're seeing some discrepancies by county in terms of how health officials decide on what data to report, not only to the public, but also to, first responders and local government officials. And I was wondering, I know the state has given some guidance to counties, but it seems like it's been more or less up to the individual health officers to interpret HIPAA laws and other responsibilities. And I was wondering why the state doesn't opt to instead give a more uniform and direction and enforced as far as like putting every county on the same boat versus kind of giving each county the flexibility to report things and work with their local leaders as they see fit.
Well, I think, Wisconsin has a proud tradition of running communicable diseases at the local level. This is obviously like none we've ever seen before, and we're working very closely with our partners at the local level. And it's part of why we have done a number of things through our daily data reporting to break information down by county, so that there is some consistency and some set of pieces of data that are uniform across the state. But obviously our local public health is working unbelievably hard, and they've got a lot on their plates, and they certainly have the discretion to provide information that is helpful and useful to support the public health and to advance what needs to happen at the local level to protect their communities. And so we continue to work with them, and we will continue to do what we can to provide county level information through our daily updates at 2 o'clock on our website.
One other point to add to that, in terms of the first responders, that is something that we've worked very closely with law enforcement and the sheriffs on, and we did issue an order that provided uniformity. So in terms of making sure that we're striking that right balance, as Secretary Palm said, in terms of protecting privacy and local control, yet at the same time making sure that our first responders who are in a difficult situation and have limited access to PPE are able to know when to best use it. So that is an order that has been issued. There is uniformity there in order to strike that right balance.
Thank you, Lauren. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this call. Governor, one of the things the president said that earlier today was that there was trying to have some coordination with states and the White House on their plan. Can you describe the level of coordination Wisconsin has had with the White House and how it's been dealing with this outbreak?
Well, I've participated in every governor's only conversation with White House. Certainly members of my staff have. So I believe our words have been heard, especially, you know, one of the things we continue to struggle with, frankly. I think that our words have been heard, but the issues of protective equipment and how we're going to need that going not only now but going forward. That's still a problem. It's an ongoing problem, but there's always good conversation. People have gotten to the point where we're trying not to throw darts at each other, but at the end of the day, there are things that we need their help on, and protective equipment is definitely one of those things.
Thank you, Scott. Now to Shaquille Brewster from NBC News. Shaquille?
This is Carol Eggers with NBC for Shaq. I just wanted to follow up on the questions about the impact of the in-person election on suspected COVID cases. Do you have a sense of when you would know if there was an impact, or could be confident to say that there wasn't an impact? And then for the governor, have you been in conversation with the Republican leaders about how to protect voters in May and looking ahead to November?
Well, I can answer the last question first. I have not been in contact with legislative leaders on that. We've just got through battling to a bad place, frankly, on the last election. We will continue to work with them to make sure that they understand how important it is to balance safety and health against the constitutional right to vote. It's a tough balance. It's not an easy one. But in turn, looking forward to the November election, we do have an opportunity to take some time and make sure that the issue of mail-in ballots is handled better than it was last time, and it would be much more smooth.
The answer to the first question about the timing of illness showing up after exposure is best answered sort of by what we know about the incubation period of the virus, which is about 2 weeks. So if someone's exposed to the virus on day one, the window during which they could develop symptoms is about 2 weeks at the most, and probably on average it's a little less than 1 week.
Thank you. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for taking my question. Secretary Palm, I just want to go back to the ventilator question that I had last week. So those 1,500 ventilators that you mentioned that the state was in talks to buy, I'm just wondering what company they're from and how soon you expect to have them in hand.
So I think I remember that it's GM. Does that sound? Yeah, Maddie, let me follow up with you. And I think we are hoping, depending on the status of the order, that we would get a very small number of them sooner, but that the bulk of them would come later, just because of the vast number of orders that the company is currently seeing. But we'll circle back with you on the details. I just don't want to get the company wrong.
Thank you, Maddie. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Thank you. I'll pass. My question got answered.
Okay, thank you. To Matt Piper from the Sheboygan Press. Matt?
Yeah, thank you for this call, as always. On the ventilator question, can you explain what happened to the previous kind of multi-state attempt to get the 10,000 ventilators? Why you, I guess, originally thought that was going to work out and why it didn't?
Yeah, so we worked together with a number of our neighboring states to try to put in a bulk order that would put us at the front of the line. We were, trying to be creative and do some bulk purchasing across state lines to get higher in the queue. And ultimately, that order fell through. The contract was not signed, which is why we pivoted to trying to place this order as a single state that is in process right now.
Yeah, basically, the original thought around it was purchasing power. You have 4 states instead of 1. Frankly, if the, 2020 is hindsight, or 2020 vision from hindsight is really good. If the federal government would have had that purchasing power, it would have been significantly more than the 4 states, or even all 50 states. Certainly better than 50 states individually. So but that's water over the dam. We need to move forward. We're pleased that we're in the position now where we actually can compete, but it's difficult to compete against bigger states, and frankly states that have enormous needs.
Thank you, Matt. Now to Jessica Van Egren from Up North News. Jessica? Jessica Van Egren?
Yep, thanks for taking my call. I just was wondering, Governor Evers, if you could expand just a little bit on the conversations you said you were having earlier today with the agriculture and small business communities. It sounded like you thought, based on that conversation, that more than one relief bill might be necessary.
Yeah, both of them are mentioning their issues that revolve around their problems. And as always, when we've looked at what we should be doing at the state level, or hopefully be doing at the state level as it relates to financial support, we would look to see where the missing pieces are in the federal law that aren't helpful to us in the state. And so both of those groups felt that to some extent there were some missing pieces, and therefore they're looking for some help from the state level. Oops. And lastly, I lost my train of thought there. Lastly, not only were the issues around how the state can help them move forward, but also both groups spend a fair amount of time talking about the issues of stress and mental health and things that we have to absolutely keep as a top priority as we go forward in this effort. There's a lot of isolation. There's a lot of people that, whether you're a small business owner or you're a farmer in Barron, Wisconsin, the issues of mental health are critically important, and that we need to address them, continue to address them, and see how the state and federal government can help accelerate that.
Thank you, Jessica. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Hi, Governor, one thing I wanted to ask you is Jim Steineke tweeted that about half the members of the Assembly will be in person at the Capitol for this session, with the rest participating remotely. I know that the stay-at-home order there's an exemption for the legislature, but do you think it's wise for 50 lawmakers to get together in a relatively small room?
Well, I don't know if, I'm sure Representative Steineke knows the dimensions of an assembly parlor or assembly room, and that he knows that these folks need to stay at least 6 feet apart, and so yes, I believe that he knows what we're hopeful of here, and whether it's wise or not, it's his call. He's the one that's calling it and having it happen here. But I'm assuming that he's taken the measurements of the room and he's going to keep people apart.
Thank you, Patrick. Now to Mark Stevens from CBS 58 in Milwaukee. Mark?
Regarding the alternative care facility at State Fair Park, is that just for pressure on Milwaukee area hospitals, or will it be accepting patients from elsewhere across the state?
Local Milwaukee leaders have been certainly leading this effort. We've been partners with them. I think initially their focus is on the regional needs of the Milwaukee area, but we also will be building some transportation plans so that if there are other parts of the state that need access, we will have plans in place to facilitate that, so that we've got surge capacity more broadly if we need it, in worst case scenario.
Thank you, Mark. Now to Angelica Sanchez from Fox 6 in Milwaukee. Angelica? Fox 6 in Milwaukee. Okay, we'll move on then to TMJ4 and Rachel. TMJ4 in Milwaukee.
Hello. Are you or will you be setting up a task force with business and community leaders to set guidelines and times to reopen the state?
We'll be having conversations with various business groups. Certainly, there are a number of business groups in the state that represent different types of businesses, and so we'll be reaching out to them. But at the same time, we will be consulting with our healthcare professionals. At the end of the day, we are going to be very careful about this decision, but most importantly, I think is, and Dr. Westergaard talked about it a bit, and I'll just reemphasize it. In order for us to get to a place that's maybe less restrictive in the state, our public health systems are going to have to look different. We're going to need more testing. We're going to need the ability to zero in on smaller numbers of people that may be COVID positive in their test results. We're going to need lots of people to work on contact tracing, and especially in our urban areas, we're going to need lots of folks to help those that were identified under the contact tracing that may have been in contact with the person identified, to help them figure out how they're going to change their life and self-isolate. So all those things are going to have to happen if we don't want to be sitting here talking next year at this time about the same thing. This has to be done very carefully. It's going to take some people to make that happen. I think the people of Wisconsin are up for this, but it's more than just saying, hey, on May 15th, it's going to be all better. Whenever it is, it's not going to be flipping a switch. It's going to be making sure that we have the public health system in place so that we don't return to where we are today.
Thank you. Now to Terry Sater from WISN TV in Milwaukee. Terry?
Yes, this is for Dr. Westergaard. How will the state track the spread of COVID-19 from in-person voting last week, and what are your expectations given the lines that we witnessed?
The method for detecting all cases is the same. Every time there's a symptomatic case that has a test and is diagnosed and confirmed to have COVID-19, they're contacted by local public health and do an interview about their exposure history. That means exposures to other people or to public settings. So through that process, people would be able to determine where in the community they've been, what other people might be at risk, and we would know at that, using those same systems that we would have. So we'll find out, if there's any signal in the coming week that might indicate that.
Thank you, Terry. Now to Sandra Torngren from Spectrum News 1. Sandra? Spectrum News? And a reminder, *6 to unmute your phone. Sandra? Okay, we'll move on then to Wisconsin Health News and Sean Kirkby. Sean?
Hi, thanks for taking my call. I was wondering for the alternate care facilities, what the staffing plan is. Does the state plan to offer any kind of money similar to what New York and Illinois have done to attract workers to those facilities? Thank you.
So Sean, the local leaders and local public health are working on their staffing plans right now. It is certainly something that FEMA asks to, and the Army Corps asked to see as part of our agreement to work together with them. And so those are underway currently at the local level.
Thank you, Sean. Now to Stephanie Hoff from Wisc Politics. Stephanie?
Hello, thank you for taking my call. My question is for Governor Evers. Governor, do you plan on extending the stay-at-home order?
We're not in a position to really make a decision on that at this point in time. We're looking at the success we had first of all, but seeing what opportunities exist in the future. In other words, we're not prepared to make a statement about that at this time.
Thank you, Stephanie. Now, our final question this afternoon belongs to Wisconsin Examiner. Either Eric Gunn, Isaiah Holmes, or Melanie Conklin.
Right. This is Eric Gunn. Thank you for taking my question. Governor Evers, you've been asked to categorize grocery store employees as first responders, as some other states have done, which would allow them access to certain child care benefits as well as certain other kinds of benefits potentially. Is that something that you plan to do, and is that something you're still considering? And if you do plan to, why, or if you don't plan it, why or why not, please? Thank you.
It's under I'm not laughing at the question. It's a great question. Yes, we are considering that at this point in time, and we have not made a decision on that yet, but clearly we understand the importance of making sure that the people of Wisconsin have access to nutritious food, and one of the ways to do that is to make sure that our folks that work in those grocery stores are doing the right thing and are protected in the right way. So we're considering it.
Thank you, Eric, and thank you for joining us for today's media briefing. Please continue to monitor the DHS outbreaks and investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, and Wisconsin Economic Development Corporation. Thank you, and have a good afternoon.